How many implants do we use?
We base it actually on things like anatomy and how much living tissue we have left by the time we've decided how many implants are going in. And is the number of implants enough to perform long-term to create our full jaw prosthetic, which will have 12 teeth on it? What's marked here are 4 implant sites. You can see these implants get very close, and sometimes they go through into the nasal chamber, but only by 1 or 2 millimeters. It's not detrimental, and it's actually a very strong anchorage point. And this is what's left of the patient's jawbone actually. So you can see that we've got 4 implants in. One of the most important things is not the implants themselves, it's actually how much living bone we've got between the implants. And what we're expecting is a minimum of 10 millimeters. Why? Because we know from our extensive work over the years that if we have at least 10 millimeters of bone between the implants, then what we have is an excellent blood supply to the bone that's surrounding the implants, which is far more important than the implants themselves. Because if there is excellent blood supply, then your jawbone will hold those implants very strongly for a long time. So that's from a surgical perspective. Now we come to from a prosthetic perspective. So we're going to fit a prosthesis on top. And if there isn't proper spacing between the implants, if we add 2 more implants into the same space, then we get very little gaps between the implants. This doesn't make things better, this makes things worse, because now what happens is we get food stuck in these areas. And if you get food stuck, you're definitely going to get infection around your implants. So we don't use 6 implants when it's right to use 4. Now I know that you'll have all been told that it's better to use 6 implants. This is rubbish. It's based on the individual need of the individual person, and it's a biomechanical calculation of all the different potential variables. Now, sometimes we do use more than 4 implants. We use the pterygoid implants that I talked about. It goes like that, and it goes like that. So then that is 1, 2, 3, 4, 5, 6. Now it's spread over a much larger area, and still the implants are not crowded. The use of pterygoid implants is a clinical decision. It's not patient choice. We're not doing requests here. We work on calculations. And the calculations are based on the anatomic reality in the short term of what the patient presents with, and even more important than that, how all of this is going to perform over decades.